Hey everyone, and welcome. Today, we're going to demystify a really important topic for anyone living in or visiting the UAE: how gender, culture, and the law all come together in the healthcare system. Let's break down everything you need to know. So imagine this: you're new to the UAE, maybe you're an expat or just visiting, and you need to see a doctor. Have you ever wondered if it's going to be different from what you're used to back home? Well, it can be, but you'll see the system is actually built on some really clear and consistent principles. Okay, so here's our game plan. We're going to tackle this in 5 simple parts. First, we'll look at the basics of the system. Then we'll get into the cultural importance of modesty. After that, we'll cover the non-negotiable legal rules, outline your specific rights as a patient, and wrap it all up with a super practical guide for everybody. Right, first up, navigating the healthcare system. Look, to really get it, you've got to understand that every single interaction is shaped by 2 big forces that work together. You've got these deep cultural norms, and you've got specific legal regulations. And they don't fight each other, they actually support one another. So let's dig into the why behind all these practices. It honestly all boils down to one foundational cultural value: a really profound respect for modesty, personal dignity, and privacy. This is the bedrock of the whole approach. And this one idea, modesty, it has a huge impact on everything. It's the reason why so many female patients prefer to see female doctors. And it's why it's totally normal for a family member to come in with you as a chaperone. By making these values a priority, the system actually builds trust and makes patients feel safe and respected. And check this out. You can see just how formally these values are recognized. This guidance from a major Islamic academy basically shows that accommodating a patient's preference isn't just, being nice. It's a deeply respected principle that's woven right into the fabric of the healthcare system. Okay, now let's switch gears and talk about the legal stuff. This cultural respect for modesty isn't just a suggestion. It's actually written into law, with 2 super clear mandatory rules for any non-emergency exam between opposite genders. These are the golden rules you have to know. So, the law really boils down to this critical 2-step process. For a male doctor to examine a female patient, unless it's an emergency, they must get explicit consent, and they must have a third person, a chaperone, in the room. And the exact same rule applies if it's a female doctor examining a male patient. It's a black and white legal requirement. And what's really interesting is how consistent this is. It doesn't matter if you're in Dubai under the Dubai Health Authority or in Abu Dhabi under the Department of Health. The core legal requirements are identical: consent plus a chaperone. This is a nationwide standard. But, of course, the law is also practical. When you're talking about a true life or death emergency, the #1 priority is saving that person's life. In those critical moments, a doctor can and absolutely should provide care immediately. The rules about consent and chaperones are set aside. Okay, so knowing the rules is one thing, but what does all this actually mean for you as the patient? Let's lay out very clearly the rights that you are guaranteed every time you step into the UAE healthcare system. As a patient, you absolutely have the right to ask for a same-gender provider. You have the right to have a chaperone with you, and you always have the right to be treated with dignity and privacy. These rights are for everyone, whether you're an Emirati citizen or an expat in any facility. Seriously, think of this list as your personal toolkit for navigating the system with confidence. All right, time to get practical. We've gone through the why and the what, so now let's get down to the how. Here is a really simple guide of do's and don'ts for both healthcare providers and for patients. For all the medical professionals out there, the message is crystal clear. If you're a male provider, you must always get consent and use a chaperone with female patients. The huge don't is ever examining them alone if it's not an emergency. And for everyone, be ready to accommodate a patient's request for comfort and privacy. It's all about creating that safe environment. And for patients, the most important thing is to be an active part of your own care. Do speak up. Ask for a chaperone or a same-gender doctor if it makes you feel more comfortable. And this is so important. Please don't ever refuse life-saving care in an emergency just because of a doctor's gender. Your health has to come first, always. So if you remember just one thing from all of this, let it be this: the entire UAE healthcare framework, from its cultural roots to its modern laws, is built on 2 incredibly powerful pillars: mutual respect for dignity and clear, open communication. And that kind of leaves us with a final thought to chew on. The UAE has built a system that legally backs up cultural respect. And it's a great reminder that the best healthcare systems aren't just about clinical excellence, they're also culturally intelligent. It really makes you wonder, doesn't it? How could a deeper appreciation for cultural context lead to better, more compassionate care, not just here, but all around the world?